Yeah, it's time for The World This Week. 7 days, 4 Paris-based correspondents, 1 hour. With us, Vivian Walt of Time Magazine. How are you?
Very good.
We're also joined by the Europe editor of the Reuters news agency, Paul Taylor. From the flagship public radio station France Inter, Bernard Guetta. And joining us as well, Emre Demir, the man you can blame for the French language edition of Zaman, the Turkish newspaper. Thanks you for being with us. The World This Week, where you can join the conversation on Facebook and on Twitter. A deadly virus will kill between 3,000 and 7,000 French in the coming months. We're talking about the seasonal flu. But it's fear of Ebola that's grounded an Air France flight in Madrid on Thursday. A passenger with fever and the shakes boarded in Lagos before a stopover in Paris. He turned out not to have Ebola. False alarm as well at the Paris area hospital, where a nurse who treated an Ebola patient was monitored. She too, it proved negative. There is a feeling, Paul Taylor, that news reporters or the news got a little overwhelmed this week with false alarms.
There have been a lot of false alarms. Those false alarms obviously don't begin with the news media. The question is, what does the news media then do about them? I
was going to ask you, because at the Reuters news agency, you're a news agency, so you decide what goes in the urgent bracket. How does it work with these stories?
I think the basic thing is to check and double check information, and to make sure that you're not running with rumor. To make sure that you've really checked it out. There's always a temptation, especially in this 24/7 real-time news environment, to go faster, to cut corners because of competition and so on. But reputations take a century to make in journalism, and they can be lost in a couple of minutes. So you really want to be sure of your information. I'll give you one example. There was a rumor which actually caused some jitters in the financial markets that another news agency, which will remain nameless, ran this week about an alert at Barcelona airport. We checked it out, found it wasn't true, and never ran anything. The question of what do you do when things are actually starting to agitate the financial markets is difficult. The other thing, of course, is that these rumors are then becoming, they're being transported also by politicians. Who are demanding action, who are saying, we've got to do this, we've got to do that, and so on, because there are risks, because there are threats, and so on. And so we end up having a discussion that's much more about how to stop Ebola where it hasn't arrived than it is about how to fight Ebola where it's killing lots of people. And that's perhaps the real scandal.
A scandal, you agree, Vivian Walt?
Yes, I mean, I think clearly there's been an enormous amount of mismanagement on various levels. Take the US, for example, that has essentially been sitting on what could have been a treatment for Ebola for years and simply didn't bring it to market because it didn't think it had any kind of commercial viability. Or the WHO, who just a few months ago was saying that Ebola is not a threat and it's going to be a kind of little tiny blip that won't grow anywhere. So, although I understand what Paul is saying, that, there's a kind of panic atmosphere here, equally, there is a very unsettling and disturbing feeling that something has come out of nowhere and gone global. The flu, of course, kills many more people, as does TB or malaria, whatever. But these are things we've lived with year in and year out for many decades now. This seems to have been absolutely unexpected, and I think it's the sort of unexpectedness of it that has got people so spooked.
All right, the unexpectedness. Bernard Guetta, it's been more than 2 weeks that Ebola's been top of the headlines, yet I find myself on a daily basis having to explain to people that it's not an airborne disease. Is that the fault, the fact that this information is just not sinking in? Is that the fault of journalists, or is it the fault of politicians?
I disagree with you. Of course, there is no real cases, nor in the United States, nor in Europe. That's a fact. But on the other hand, how could we imagine that we could confine this illness to West Africa? I don't imagine it. I don't think it would be reasonable to think so. because the world is open. There is every day 10,000 flights between Africa and Europe, between Europe and so on and so on and so on. And so there is a real risk, not a certainty, of course, but a real risk that Ebola could become the plague of this century. And the risk is on the table. And we are not at all prepared to cope with this illness. Not at all. So I understand you. There is a panic. There is an excess of fear, of remorse. That's obvious. But on the other hand, the danger is absolutely real and frightening.
All right, the danger is real. No major outbreaks. Governments are reacting with screenings now at airports. Screenings here in Europe for arriving passengers, which the World Health Organization has all but debunked. Thus, Daily Telegraph cartoonist Matt imagines a Heathrow baggage handler telling a passenger, "Your luggage had a temperature, so we lost it." Emre Demir, your thoughts on the way that governments are handling it?
Well, I think that the Ebola epidemic is a real crisis. The Ebola epidemic is out of control in 3 countries and directly threatening 15 other countries in Africa. And the international community has done so far so little, and they are so late. We could have handled this crisis if it were in Europe, if it were in North Africa, or if it were in the United States. It's because it's happening in Africa, and that's, I think, we are so late in handling this crisis. For example, we do so little. If you look at, for example, the UN fund for Ebola outbreak,
they say they need $1 billion and they only have a third of it.
$100,000 already. So I don't think that the governments are aware of this, the seriousness of this crisis. I don't think that we are making a panic out of nothing. This is a real crisis. It's more important than SARS epidemic. If you look at the numbers of the death tolls. Yeah.
Just an example, if I may. I do think that Morocco is absolutely right to refuse to organize the African football competition on Morocco. There is a real danger to propagate the epidemic.
All right, there's a real danger.
I just say if we don't do more than we're doing now to fight the epidemic there, then we will have to fight it here. That's for sure. But I think we've been slow. You know, if you look at the timings, even the World Health Organization has not covered itself in glory, I think. They've had their budget cut since previous problems, but they declared a major health emergency on the 8th of August. The United States started to get mobilized at the beginning of September. France announced in mid-September it was going to send a military hospital. Is the military hospital there? Has it moved? Has anything happened? You know, and the European Union, which is not the first line because it doesn't have competence for health, but should be coordinating, you know, you don't see an awful lot going on.
They say they're struggling to find volunteers, by the way, to go out there.
Yeah.
After health officials in the U.S. proudly announced that they were ready for Ebola, a Dallas hospital apologizing after it turned out that not one, but 2 nurses caught Ebola from treating a patient who'd returned from Liberia with the disease. Republicans making it even a campaign issue, calling for a travel ban with West Africa, and for Barack Obama to, quote, actually lead on this issue, as one Kansas senatorial candidate put it. The U.S. president clearing his schedule 2 days running this week to address the Ebola crisis. He answered thusly.
I don't have a philosophical objection necessarily to a travel ban if that is the thing that is going to keep the American people safe. The problem is that in all the discussions I've had thus far with experts in the field, experts in infectious disease, is that a travel ban is less effective than the measures that we are currently instituting.
You don't agree, Bernard Guetta?
I'm not sure. I'm not sure. A travel ban wouldn't be, on my eyes, a stupidity. At least we should restrain and I mean a real restraint on the flights to and from West Africa? Certainly yes. Certainly yes.
Of course, we had a virologist make the opposite case, saying that you need to keep those borders open because you need to get the help in and you need to...
Okay, special flights, special medical flights, special occasions, okay, but regular flights, 10 or 20 a day to Europe and the US and Asia and so on.
I mean, in effect, in reality, the travel ban is more or less in effect. It's not a ban, but travel has been so restricted.
Yes.
If you now go online and try to find a flight to Freetown or to Monrovia, you might find one a day, and it's going to cost you 8,000 euros. But they simply don't exist anymore. But I think one of the things we're missing is the kind of enormous damage this is doing to the region itself, and the fact that these countries are now essentially cut off from each other at a time when the trade between each other is one of the few things that's really growing and thriving in West Africa, and the economic damage this is going to do, I think, is going to be it's just going to take years. It'll probably be a far longer lasting thing than the virus itself.
All right, somebody on Twitter saying to us that they're casting doubt again on this idea of checking people's temperature at the airport. Ebola has a 21-day incubation period, so people are likely to pass airport screenings while being sick. Again, the issue addressed there by Vivian of what do you do to help out West Africa? And again, the problem of people just don't want to go right now.
Well, I think the problem is more profound. If you look at the scale of the epidemic in West Africa, a lot of virologists say that the isolation method or monitoring contacts will not be sufficient, because we don't know yet that if we can handle this crisis without a cure. It might be too late to just isolate, to apply a travel ban, to avoid the spread of an eventual outbreak in Europe or United States.
All right. The situation with Ebola will continue to follow it. And one final point on this, and I'll put it to you, Vivian. Barack Obama, it's really turned into a campaign issue for him.
Well, unfortunately, every time he hits a major crisis, it seems to be the reflexive action seems to be to appoint a czar to handle it. Yeah. And once again, he did this afternoon. It was clearly practically the right thing to do, but it left him looking like he really didn't quite know what to do, and therefore he was going to appoint somebody to manage it.
Some are even saying that the way he handles Ebola will make or break how the midterm races pan out in November in the United States.
Seems to be a lot of other issues on the agenda, including the market tanking and a new war in Iraq and various other things on people's minds.
Right. Well, let's talk about...
Barack Obama doesn't know what to do. But who knows what to do? Nobody does. Nobody does, really.
All right. Vivian mentioning that problem in Iraq. Let's talk about it now. Beginning, of course, in Syria, across from the Turkish border, the fate of the Syrian border town of Kobani remains, well, literally up in the air. The U.S. claims coalition airstrikes have stopped the advance of the jihadists of ISIS. And with Kurdish fighters clearly providing on-the-ground intelligence the last couple of days, those strikes growing more precise in what's Syria's third largest city. But the jihadists remain determined, and they're gaining ground elsewhere, like in Iraq's mainly Sunni Anbar province, where ISIS continues to gain ground. Some are even talking about infiltrations reported as far away as the outskirts of Baghdad earlier this week. It's proving incredibly resilient, ISIS. It's what we've talked about, Emery Demir, in the past, as a kind of a game of whack-a-mole, where you go for them in one place, they pop up in another.
Yeah, the international press legitimately looks what's going on in Kobani, but Anbar region also is much more important for ISIS. It's one of the largest regions of Iraq. It was one of the main battlegrounds since 2003 for the extremists, and And if ISIS gains the total control of Anbar region, it would be more bad news for Baghdad regime. And if the coalition forces can stop the advance of ISIS in Anbar.
Are you surprised at the resilience of the jihadists?
Of course, as I said, this region was always an important region for the extremists since 2003. And the coalition forces looking at elsewhere what's going on in Kurdistan region, and they're gaining ground. If they gain total control of the Anbar region, it would be a risk for Baghdad regime. But if they lose in Anbar region, I think that it might be the fall of ISIS in Iraq, maybe also in Syria. That's strategically important for ISIS. It's much more important for ISIS than Kobani, I think.
This is, of course, the big difference with Al-Qaeda is that they're actually looking to stake out turf, and they're still trying to look to gain cities and to take over territory, actual physical territory.
Well, of course, because Al-Qaeda was never a local force. It was an international force. It was pure ideology, and terrorism also, of course, but pure ideology. If we take now the Islamic State, how do you say in English? EI or
ISIS is
ISIS. Okay. This is completely different. This is a local force. What is their goal? They want to build a Sunnite state across the border of Syria and Iraq. And this is a national goal. Let's say a national goal. And so this is not a surprise that they are so strong, because they have a strong support of the Sunnite tribes against the Shiites. The Sunnites in Iraq are not at all the jihadists, but they want to gain the support of this group. And this is an alliance against the Shiite and Iran. And this is a regional game. And the question now is the borders of Iraq and Syria, and probably Lebanon, and probably Jordan one day. So this is completely different. This is not ideology. This is nation building.
This is nation building is what you're saying. I wanted to pick up on that point with the rest of our panel. We're going to take a very quick break and return. This is The World This Week.